everybody!
Do you guys love
my mom hairdo? Yeah. You know, I'm living the best mom life right now. I wake up, breastfeed the baby, and just focus on her all day, every day. That's it. And I kind of don't have much time for myself, not much to do my hair, not much to look cute today. I'm in PJs, but guess what? I make it work. All the moms out there, make it work. Anyway, for today's vlog, it's been a hot minute, so I don't even know how to explain this. We are picking it back up. What do I mean by that? Yes, you guys have seen our past vlogs or vlogs that have been coming out, but now it is, what is it? It is February. Yeah, the vlogs you guys have been seeing previously have been pre-recorded. I just was never able to, you know, post them because things have been very crazy. And it's time for us to update you guys and let you know what has been going on. So
let's get started.
Because, oh my god, I'm like on the verge of a migraine.
Let's go talk to Paul.
Alrighty guys, so I hope you guys are excited. Our setup is a little different today. We are outside. We have baby Sushi here.
Baby toys.
Yeah, and she is just very vocal. She loves to smile.
Brings joy and love to anybody and everybody who she's around.
Oh, we love you so much.
She's like, I know. So let's get started. Let's catch you guys up.
Because, oh my god, so much has happened.
So, of course, you guys did see in the past or in our past vlogs, Paul had appendicitis.
Oh my goodness.
And I'm
sucked.
going to be honest, I think the reason why he had appendicitis is because his Crohn's has been a little bit
Cray.
Little.
I'm being optimistic for you, okay? So it's been, how do I say, a snowball effect lately. That's why for a while, guys, you have not seen us post because we have been just focusing on Paul's health, and it's been a crazy roller coaster of a journey.
We're only through the first loop. We got about 17 more to go.
So sadly, I have not recorded Paul's past doctor's appointments. You guys will not be seeing that just because I have been just mainly focused on him and his health. It can be difficult sometimes to record, be in the doctor's office, be a good caretaker. It's a lot to juggle. And now on top of it, also being a mother, like
that's the extra cherry on the top.
Yeah, so it's been a little difficult, so I'm sorry guys. You will not see any of those events, but we are here to update you, and from this point on you will be seeing what has been truly going on, and you'll be kept up to date. So let's get into it, shall we? Paul, when did it start all going downhill? I would say in November when the appendix came out. Ripped them out.
Pretty much. I was never doing great this past year, and we've explained that before since I was on Stellara. I haven't ever been at 100% in all honesty, and at one point I just started like going downhill very rapidly. My GI doctor had wanted me to do a colonoscopy, which the prep for this one was by far the worst pain I have ever been in, and realizing why, it made a lot of sense afterwards, okay? And we'll get into that in just a minute. So leading up to that, I actually did have to get my appendix taken out, and the thing is that I've been to the hospital before for a lower right quadrant pain, and I've been to the hospital. They told me, you're fine, it's a ligament.
It's a ligament
You're
pain.
fine, don't worry about it. And I've been hospitalized for like 2 days while they're trying to figure it out, and they've literally just blown it off as that, a ligament, and never paid attention to it.
Mind you, people with Crohn's have a very high chance of having appendicitis.
Yes,
so
higher than most.
yeah, it's ridiculous how they just brushed it off. I mean, literally, ligament pain, they don't want to do much testing. Like, you're fine, just go home.
Yeah, the second to last time was the worst when I went in, and they were like, no, you're fine, just go home. I was like, can you at least do a CT scan to see if you see like the appendix inflamed or, you know, something going on?
They're like, it's probably your basic Crohn's or something.
Yeah, that's literally just wrote it off as that. And I was like, I would feel so much more comfortable going home knowing that I got a CT scan and you don't see my appendix gigantic on the scan or anything, you know what I mean, or something going on.
So that was a lot of advocating.
That was the second to last time. They gave me my scan, whatever, no big deal. I didn't have it. I went home, but I still had the pain, and they were kind of like, my primary is kind of like, it's very odd that you're having a pain right there. It sounds like it's your appendix, but on the scan it's not. So what ended up happening is one day I started having this pain. I realized that I wasn't able to lift up the baby much. I wasn't able to do certain things, certain movements, and I was like, this is kind of odd. I'd lay down, it would kind of go away, and then one night, Janice and I were just laying in bed, baby's fast asleep, and we're watching TV, and I literally just, it's like as if someone takes a knife and is like slowly going into your abdomen. And I was like, babe, call my parents. I need to go to the hospital now.
Yeah.
I couldn't move. I was in such, like, it was, the pain was getting really bad really fast. So I was like, let's not wait. Let me go to the hospital. Screw this.
Thankfully, they took him serious. They said he had appendicitis, and
yes,
they ripped those suckers out.
Yeah, it was the funniest thing because by the time they figured it out, it was like 2 a.m. I thought I was going home with, you ain't got nothing. Doctor comes in. Appendicitis, you have surgery in 6 hours. I was like, wait, what?
Now Paul is doing a lot better. He has been able to recover in that aspect, exactly. But then once again, from there, it still went downhill. So afterwards, he did do a colon and endoscopy. And, me and Paul have been together for a very long time. I have been there for his very first colon and endoscopy.
Yes.
And the first one, I remember the doctor was like, everything's green inside, like you're doing really bad. And there was a lot of polyps, ulcers. You had over like 50 ulcers at first.
I have 50 ulcers. The official report said 50 plus on the inside of my stomach.
Yeah.
So at that point, that was the wildest or the most active my Crohn's had been in, because it was both in my stomach as well as my large intestine or colon.
Yeah. And then for this colon and endoscopy, I was like, how much worse can it get?
It got worse.
Like, I guess I just couldn't fathom it, honestly.
Like I mentioned before, I had horrific pain with doing this prep, and obviously if you don't know what the prep is, it's to clean out your colon so that when they go in with the scope, they can properly see everything to give a proper diagnosis or check what's going on, see any polyps, see any potential colon cancer, any Crohn's, any ulcerative colitis, so on and so forth, right? They couldn't do that for me.
They couldn't finish the colonoscopy.
The inflammation on this part goes down into your rectum. The inflammation on my descending colon was so bad they couldn't get the scope through.
And they tried to do a pediatric scope as well.
And the pediatric scope didn't fit either. So that should give you an idea of how horrifically inflamed and active my disease currently is, and it accounts for me feeling the way that I currently am feeling.
The proper term for this type of situation would be an intestinal blockage.
Colonic obstruction, because it's very specific in my colon. And it's just one of those things that this can go from bad to worse ridiculously quickly. Thankfully, my doctor, we caught it, I would say relatively early, kind of, what I mean?
Not really.
With this being caught at this time, that made us have to do a complete 180 in the sense of my diet and how we're handling things. So the approach that we were doing before was not working out. I have to go into a little bit more an aggressive treatment, be on 2 different biologic medications, and then we took it upon ourselves of changing my diet up 100% and doing something very drastic, very aggressive to kind of help, because again, this can go from bad to worse very quickly.
I was told, we are going into appointments. Once we saw this test result of the colonoscopy, the doctors were acting fast. They're like, at any moment, you could be blocked. It's going to be bad. So in the appointments, they're telling me, they're like, be prepared. If he gets a true blockage, 100%, you need to rush him to the hospital. And one surgeon actually was like, you're going to be begging me
to rip it out,
to take it out once you feel that pain 100%.
So my GI doctor recommended us to go to a colorectal surgeon because the inflammation is so intense.
Yeah.
And we don't know how long necessarily the inflammation has been there. I had done a colonoscopy less than a year ago, and from less than a year to now, it has progressed really, really bad.
Yeah.
Now, the fear with severe inflammation like that is 2 things. Intestinal blockage, which if there's a blockage, guess what? I have to remove my colon. That's how serious this is. And the second problem is, with such severe inflammation, it can go either with medication and treatment, the inflammation, goes down and alleviates and the colon goes back to a normal size, or that it doesn't and the inflammation turns into scar tissue. And if it turns into scar tissue, there's always that possibility of a blockage. And again, end result is I need to have my colon removed. So that's what prompted us to go see a colorectal surgeon, to bring them in and see what they think, what are some possibilities. And that's, you know, not a fun conversation of having to have your colon removed and a colostomy bag placed there for the rest of my life.
So guys, this is where we are going to end it. We're going to take a brief pause, you know, because this history or this time of our lives is a lot. So we're going to...
Very emotional.
Yeah, we're going to cut it up into sections of vlogs. So the next one, we're going to talk about what happened with this surgeon and what he said to us. And let me just say, I left that appointment crying. I was just...
I think we all did.
Yeah.
Even my mom was crying. Like, she didn't go to the appointment as soon as we called her and everything. Yeah, it was not good.
Yeah. So guys, till next time, we're definitely going to keep you updated. Watch for the next vlog. It will be out very, very soon. So stay tuned for part 2. For now, adieu and goodbye.